Welcome back to Isaac's Dentistry. Today we're going to do something a little different. There's a ton of misinformation, or if you want to call it myths, floating out there about dentistry and your basic oral hygiene and oral health. So today we're going to do a little myth busting with some very common myths that are out there about oral hygiene and dentistry. So we've got Doc here. I'm going to throw a few of the myths at him and let him kind of tell us why or why not that is accurate, and kind of dispel some of the things that are out there that maybe some of you actually are doing or believing. So, Doc, let's start off with a very common one, and it's been around forever, and that is that metal fillings cause disease. If I get a metal filling, I'm going to end up having Alzheimer's, or,
Sure.
you know.
Sure. Metal fillings, just give you a little bit of history, they've been around for about 150 years. When I say the metal ones, we're talking about the alloys that are mixed with mercury, and they're silver. There's about 5 different metals in it. But the ones that people are concerned about is mercury, and we are too. We're concerned about mercury. We don't handle it. We keep it in a special container. The mercury vapors, we eliminate the mercury vapors, and when we suction it, we're always wearing masks. So there are problems with mercury, but once mercury is inside of the alloy, it is safe, and it's been proven that for probably about 20 years or so. But we still have people that are concerned about it, and voice your concerns. But because we do have the literature that does back it up, we still use alloy. We still use dental amalgam. We're going more and more to the composites. A lot of dentists don't even use it anymore. We use it if we have to, but we certainly put the white ones in because they're a little more aesthetic, and they're starting to last longer too. We're getting better results from it. But the myth is they don't cause the mercury fillings do not cause disease. It's never been proven. But we're concerned about it too. We don't like to handle it. The problem that you really get with the mercury fillings is the vapors. Whenever we're cutting them out, when we're drilling them out, the people that are the operators, that'd be me and you sitting there breathing the vapors, the ones that could cause damage. But as a general rule, we know the dentist and the dental assistants are not having problems with it.
So, because I've got a bunch of those metal fillings from when I was a kid, I don't need to worry about developing Alzheimer's because of those metal fillings.
No, don't believe so. Now, so we're going to say myth busted.
Busted. All right. So another one we hear a lot is about wisdom teeth. So, Doc, we hear a lot that wisdom teeth have to be pulled.
Right. Not all mouths are equal, and certainly not all wisdom teeth are the same. We try to keep the wisdom teeth in if the mouth does support it. Now, if you've got a big father and a small mother and they have babies, sometimes that doesn't work out just because of the genetic component of it. But as a general rule, not all of them have to be taken out. Now, we take out some here. We refer a large percentage of them to an oral surgeon to be sedated. But don't, just because you have wisdom teeth doesn't mean that you need them. We like to leave them in case you lose another tooth in front of it. It's an insurance policy. We can hook a denture to it. We can hook partial plates to it. We can do a fixed bridge to a wisdom tooth. So they are valuable. So don't go taking them out unless, if we tell you they need to come out, then they probably do. Actually, they do. But that is a myth.
Right.
Busted.
So there are reasons those wisdom teeth would have to come out, but it is not a general rule that all wisdom teeth have to come out.
Right.
Not all.
Right. What do we got?
This was one that threw me off because I hadn't heard it. Women will lose a tooth for every child they give birth to.
I have heard that, and that's an old wives' tale that for each pregnancy, for each birth that you give, you lose a tooth. Now, women do tend to get more periodontal problems during pregnancy. There's a condition called pregnancy gingivitis that women get. Giant cell granulomas. There's other kinds of pathology that women do get when they're pregnant, and it's more of a hormonal problem than anything. Also, when women are pregnant, they don't feel very good. A lot of them, they're nausea. If they are vomiting, then they get the acid on the teeth. So there are a lot of problems with it. Now, another thing, your oral hygiene will go down, and if you think about it too, when you can't sleep and in the middle of the night, you're getting up and you're sipping on things, you're eating, doing anything to calm you down, and we're not brushing after that. So the pregnancy doesn't really cause it, but some of the occurrences around pregnancy will cause women to have dental problems.
Dental problems.
Doesn't cause it.
Right, but
Yeah.
so if you have 5 kids, you're not guaranteed to lose 5 teeth. You just need to make sure you take care of your teeth and brush and do your normal hygiene routine.
And also after delivery is when a lot of problems happen, because women, they're up nursing, they're the kids are crying, and they're up and they're sipping on soft drinks, sipping on orange juice, something like that. It's acidic and it has a lot of sugar in it.
Right.
So that's the problem.
All right, so you're not going to lose a tooth for every child that you give birth to.
Right.
Here's another one, and we hear this probably daily. Root canals are extremely painful.
Yes. Whenever we tell somebody, I used to even try not to even say the word root canal, because people have, as soon as you say that word, it just alarms go off. But root canals are not painful. We do one daily. I do a root canal today. I'm not sure if we did one. We did not do a root canal today, but we do them almost daily. Either start or finish one, certainly.
Yeah.
But what is painful about a root canal, about that, is the toothache. You come to see us with a toothache, you're swollen, you feel terrible. We give you an injection, get rid of the pain, take the inside of the nerve out, put medicine in it, and generally that takes care of it. So that's the worst part of the root canal. But it is, and everybody always tells their neighbor, oh my goodness, they don't have that, they're terrible. Here they're terrible. My aunt had one and it was terrible. No, your aunt had a toothache and that was terrible, and the root canal got rid of it. Now, could there be inherent problems with root canals? Certainly. See that a lot too, but root canals, as a general rule, are not painful.
Right, so it's just people conflating the toothache pain with the root canal.
Post-op, we've had 2 this week. We had post-op pain with root canals, and that was more of an occlusion problem. It's a lot of inflammation. We treat it with the right medicine. It's fine.
Right. All right, so root canals aren't extremely painful. In fact, I tell everybody it's no different than getting a filling, and most people, after it's done, they've agreed with me. It's just that toothache is what hurts.
And it's creepy, and you got to listen to everything,
right.
and it's just, I get it.
Now, I have heard this one. Brushing your teeth with lemon juice is going to make them whiter.
Yeah, that does not work. If it makes it whiter, it may bleach it out just for. The reason why it bleaches it out is probably it's an acid, so it's eating away some of the top layer of the tooth, which you're getting new enamel on the tooth, and that might make it whiter for a little bit. But if you keep doing it, pretty soon you're going to wear away the enamel, and you're going to get the dentin, which is the cementum underneath of the tooth, and that's yellow. So it's going to eventually make your teeth yellow. I'd say probably within a matter of months if you did it.
Right. So that it's not going to whiten as much as that acid is actually going to cause damage.
You're going to erode the top layer, which might give you the perception that they're whiter, and they probably are. That new enamel that you just created,
right.
You got rid of that stuff but you damaged your tooth. So you don't stay away from that.
Yeah.
There's other ways to whiten your teeth. That's not one of them.
Yeah, not lemon juice. Here's one, and this is kind of a twofer. You can't get X-rays or even see the dentist while you're pregnant.
Yes, we the way we use X-rays now, we use it's a cone paralleling technique. So when we shoot an X-ray now, we're shooting it through a little circle, and we even cone cut it, so we have to have them lined up perfectly. So the X-rays go in a straight line. So when it's sort of like shining a flashlight. If you shine a flashlight, it's going to go in that straight line as long as you got a cone. Years ago, we spread them out all over the room. That's why the dentist would actually leave it. I remember as a kid watching my dad do it. He had this thing, and he'd make everybody stand back, and it would zap, and the study showed it went all the way around the room.
Right.
But if you use the cone, which we all do now, I don't think you need. I've never seen one of those in years, probably since the early '80s or so, since I've seen one. So when we have pregnant women, if we need X-rays, we certainly take them. We never over X-ray anybody, so we treat them just like we would anybody else. And we always use and if you have any concern, you say, yeah, but still, certainly we have lead aprons that we use routinely. That they put people at ease. We actually had a patient this week that wanted the lead apron while she got her teeth cleaned because it made her feel secure. So it's kind of like a comfort blanket,
yep,
a thunder blanket. Yeah.
Yep. So X-rays, we can do them. It's a very focused beam. And we also have the lead blankets that we're going to cover you with. So there's plenty of precaution. You do not need to worry. Make sure you're still getting your teeth taken care of, even if you are pregnant.
In these digital X-rays that we're using now, we said this before, it used to take 40 X-rays to equal 3 hours in the sun. Now it's 400. So it takes 400 X-rays to equal 3 hours out in the sun. And for the years I've been doing this, 30 years plus, I've never taken 400 X-rays on a patient. You know, cumulatively. So it is a cumulative effect of the X-rays are.
And this next one, it's kind of like the silver fillings. We've all grown up knowing about fluoride. Mm-hmm. Fluoride is going to make me sick. So don't use it on my teeth.
Right. That came in the late 60s is when fluoridation came throughout the United States, and each little community had a little boat on it, and the local water districts did it, and the cities did. There are still cities. San Antonio was the last major city, I think, just a few years ago, back in the 90s, maybe a few years ago. That's 20 years ago. 20 years ago, I think San Antonio finally got fluoride. They were one of the last holdouts. Northern Kentucky was one. Cincinnati and Northern Kentucky, they didn't have fluoride for a long time. I think they do now, but there are still a few little pockets that don't. Fluoride is very, very safe. You need about 1 part per million in the drinking water. Now that we're drinking a lot of bottled water, a lot of people aren't getting enough fluoride, so we give it in the office now. We went through years we didn't even use fluoride here because there's enough in the water. Now people aren't getting it in the water, so we are using that. So too much of anything is harmful. So too much fluoride will cause fluorosis. It'll cause the enamel to erode, but 1 part per million is fine.
Right. So it's going to be very hard to get to that point where fluoride's going to be.
Never seen a problem. I have seen some fluorosis where people, we used to do it here in the schools, they'd have swish and spit days, and they were kind of overdoing that too, so we don't even do that anymore. I don't believe here in the county. I told them, years ago I had a conversation with the school administrators, and I think they stopped that. So.
All right. So, my parents have bad teeth, so I'm going to have bad teeth.
Yeah, that's a myth. If your parents had bad teeth and you do, there are some genetic components. I'm not going to say saliva content, the enamel composition, but as a general rule, that's a myth. It's not true. What is true is the lifestyles, the same things, the same reasons why your parents had bad teeth, you probably are too, and it could be hygiene, it could be poor gums, it just could be any number of things. But as a general rule, that's a myth. I'm going to put that's a myth with a little asterisk by it, because there are saliva, there are things that I do see it. I see it running in families. There's other thing, something called osteogenesis imperfecta. There was a family here in this area that had it, so it was in the gene pool. And if the 2 right people had babies, then they would see it. And we saw that. I haven't seen it in a long time, but it was here.
Right, but as a general rule.
Right, you don't get that.
Right. All right. We hear this all the time too. It's dangerous to pull an abscess tooth.
Yes. Not so much now as years ago. People come in, I can't get my tooth pulled. Can you give me an antibiotic? And I said, yeah, I can give you an antibiotic. I said, we should go ahead and get the tooth out. Well, they're reluctant because they've heard that you can't pull a tooth what's abscessed because it's dangerous and it can kill you. No, that's not true. What can kill you is the infection inside there. So removing the etiology, taking that out is a good thing. I would think probably somebody did die after that happened one time after they had a tooth pulled, and that got to be a myth, but that's not true.
Right.
We take them out all the time. If we can get them numb, sometimes it might be a little tougher to get numb, but if we can block it or use the right anesthetic, that's generally not a problem. But if they're swollen, especially on an upper one, we will give you an antibiotic for a few days, kind of calm it down, and then we'll get it out later.
Right.
When you feel better too.
So actually pulling an abscess tooth is actually a benefit.
It's a benefit. It is a benefit, and yes.
We probably hear this daily. Getting my teeth cleaned caused me to get a cavity.
Yeah, we hear that. A lot of people don't want to get their teeth cleaned because either they heard it or it happened to them. When we clean teeth, we look for cavities. We actually look. We do an examination and we're looking for it. But specifically getting your teeth cleaned won't cause it. we're going to get the tartar off and look underneath there, and we can see it. We are going to expose your gums a little bit to it because all that has to be taken off, and they may be sore. We get that too. I don't want to get my teeth cleaned because, man, it was sore for 2 weeks afterwards. Well, it was sore for 2 weeks because you hadn't had it done in years, and that's why it was sore. The next time it won't. Kind of like working out. If you haven't worked out in a long time and you do it, man, you're sore. You can barely walk. But the more you do that thing, the more it becomes part of your routine.
Well, and a lot of times also what will happen is by cleaning teeth, they'll knock some calculus or plaque off that was covering some decay.
Sure.
And that's why your tooth is now sensitive.
Yes,
We've now knocked that that coating off, which is actually helping cause the decay.
Mm-hmm. Yes, exactly, without a doubt.
This is one of those rural myths.
Okay.
And that is, my fever blisters are caused by my tractor's smoke.
Oh yes, Scott and I were talking this morning, and I put that one in there because I have had some farmers that come in, and they had a fever blister, and they want to know what they can do for it. Or I told them, I said, "Oh yeah, you got a virus. It's the herpes virus, probably herpes 1." But of course, those we've had to talk about those two. I'm getting sidetracked here. Pull me back. But yes, the tractor smoke does not cause it. It's the sun that's coming down while you're on your tractor that does it. That will do it. Women or people when they go to tanning beds will get fever blisters too. So that's what's causing it. But it's not. That's when we were trying to think of myths today. I said, "Oh, I've got one." I've had 2 people tell me that over the years that the tractor smoke did it. But it's not the tractor smoke, it's the sun coming down and you happen to be on your tractor. So
there you go.
That's how myths get started, don't they? They kind of propagate themselves.
Exactly. Once you treat a decayed tooth, once we get that decay out of there and put a filling in it, that tooth's not going to decay anymore.
That's not true. That the tooth, the filling won't decay, but the margin around the tooth will decay. So once you've got a filling in there, the most common place to get a cavity, excuse me, is around an old filling. So we're not really creating that, but if you think about it, if you had a tooth and you had a pit down in there, and that's where the cavity started, we're taking that pit out. But now we got a margin around the thing that can cause a cavity too. So that has to be cleaned. That has to be examined, and that's what we do when you get your teeth cleaned. That's why we actually look in there too, and just to make sure everything's not leaking, because fillings do leak, and once they leak, they're going to get bacteria in it. So yeah.
Well, and the other thing is you got like 5 surfaces to that tooth. So we may put a filling on the top of that tooth, but then you may get a decay on the side
yes,
or
exactly,
between teeth. So
good point. Yeah.
So your teeth can still decay just because.
But we've had people say that, and it's pretty common. Say I can't get any more cavities. I've had all my teeth filled. And you can. So
right.
And you will.
And I like this one because a lot of people get toothaches.
Mm-hmm.
So this myth is, if I place an aspirin tablet next to my tooth, it's going to relieve my toothache.
No, that's not the way aspirin works. Aspirin works in your brain. It inhibits the prostaglandin release in your brain. So putting an aspirin on there is going to do nothing to cause your pain to go away. Really, the studies have shown aspirin's been around so long, they're not even sure how it works, but it works. It's an easy substance to make. The aspirin is the salicylic acid, but it works, but not to put it as a topical. It'll actually burn it if you use it as a topical on your jaw, and we still see that quite a bit. People will put an aspirin on their tooth. Mm-hmm. If it does work, we go back to the gate control theory, to where you're stimulating different fibers, so the pain fiber is not being stimulated, and you're actually burning your jaw. So that's a little bit bigger fiber. So it's the shake in your hand that's doing it.
It's a distraction.
It's not the good one.
It's not a fix.
Yeah, it's distracting the pain that you already have. Yes. Thank you, Scott.
All right. My sister's allergic to penicillin, so I am too.
That's a myth. If your sister's allergic, doesn't mean you are. I'm not going to say there's not a genetic component to that also, but we just don't see it. Mm-hmm. We don't hesitate. If your sister, if you have a family member, mother or father, or even both, Am I concerned about it? Yeah, just because we always ask people if they're allergic to anything. We always ask them 3 times, if you notice, when we're in here.
Yeah.
But as a general rule, no. But there probably is some type of genetic component. But the first time, if you've never been exposed to penicillin, and we all have generally as a child, the first time or 2, it's not a problem. You might get a rash, you might get a little itching, but it's the subsequent exposure to the penicillin, which will cause problems, which could be an anaphylactic shock, which is deadly, and it can be. It's an emergency situation if that happens to you.
Well, and I can speak to that one because I am allergic to penicillin, but neither of my brothers are.
There you go.
They've taken it their whole lives. So.
Busted.
There you go.
Okay.
Pregnancy causes tooth decay because a baby takes the calcium away from the mother.
No, that's not how it goes. The teeth are already formed, so it won't cause tooth decay. Now there are some of the bones are somewhat affected just because the baby is pulling some calcium, but not from the teeth themselves. So it's not causing tooth decay. So that's not true.
Yeah, it's kind of like we talked about earlier. It's more of a mother's habits are altered with oral hygiene after birth, and that's usually what causes the issues, not
exactly not the pregnancy. Yeah.
Not the pregnancy.
Yeah.
And lastly, we were talking about getting teeth extracted or pulled. Smoking after having a tooth pulled will give me a dry socket, so I shouldn't smoke after you pull my tooth.
Most every dentist will tell you after you have your tooth pulled, don't smoke cigarettes. Now, and I don't tell people to go out and smoke after they've had a tooth pulled, but it's my experience that it's the smoking before you have a tooth pulled that causes the dry socket, not the smoking after. So if somebody needs to smoke and they're addicted to cigarettes, and it's going to make them feel better and calm them down, that's not going to cause the dry socket. What's going to cause it is the carcinogens and the nicotine on top of the tissue that's going to cause it. It just doesn't heal very well. So it's really not the smoking afterwards; it's the smoking before. So we take out a lot of teeth here, and a lot of our patients are smokers. So we see a lot of dry sockets, and so I don't really get bent out of shape if you smoke or not. After you leave. To me, if you need to, we've had people that right in the middle of extractions, they're real nervous. They want to go outside and smoke. I'm fine with it. I've seen that too. So we live our area right here. There's a lot of smokers, and if they're having anxiety right there in the middle of something, and they need to calm their nerves down a little bit, that's fine. So it's the smoking before, not after. That's the point I want to try to make.
It's that you have a history of smoking, not the fact that you're going to smoke right after you walk out of the dental office.
Right. Now, as a medical professional, for me to sit here and say, "Oh, smoking's not a problem," it is. It's a major problem. But if it's going to alleviate your stress temporarily, I'm fine with that for what we're doing here.
Right. So those are. I
don't want to get in trouble with any kind of medical or dental society. We have other ways to relieve stress. We can use diazepam. We use Valium, Ativan. We could do something, or nitrous oxide, but we don't. But if smoking helps you out, I'm okay with that. Well,
and we've also seen here that people that are smokers are gonna smoke, and why you go through having a tooth pulled and now going through 3 days of withdrawals
with a bad tooth, and you're nervous about something, you're getting a dry socket, and man, if I could just have a cigarette, go ahead and smoke it.
Right. I mean, the withdrawals can heighten everything else and make everything feel worse. So in the long run,
Yeah.
All right. So those were 15 myths that I know that have been out there. Hopefully, it was a little informative and a little fun for you to kind of maybe learn something different about the dental industry, and we'll see you the next time back here at Isaac's Dentistry.